Hey, this is Rudy Owens, and I wanted to give an update on my effort to engage the public health community in the United States to support a long overdue intervention that they should and could be doing, which is to support adoptee rights legislation and state legislation policy debates relating to access to original vital records and access to family health history. On January 15th, I sent a letter to the Nation's Health, which is a publication of America's national public health organization that represents public health collectively, which is called the American Public Health Association. That organization has not responded yes or no if they're going to publish my letter. My letter is not published. It's a letter to the editor. I have a master's degree in public health. I have a master's degree as well. So I don't think that my qualifications are the issues. I sent the letter in on January 15, 2024. The date is April 6, 2024, and still no response. My assumption at this point is they're going to just refuse to acknowledge receiving the letter and responding to me. But here's the letter that I wanted to share with people to know what it is I'm asking the public health community to do, which is, in my view, an evidence-based public health measure to support public health. Here's the letter that I wrote. Dear Editor, on December 29, 2023, a biological relative on the maternal side of my birth family died suddenly of cardiovascular disease. It is pervasive among my Finnish American and Finnish relatives in Michigan and Finland, where I have ancestors. Today, most health and public health experts, including the Centers for Disease Control and Prevention, encourage all Americans to know their family health history to share with their medical providers to promote better health. For me, my Finnish ancestry means I have an elevated heart health risk. Finns as a population have dozens of identifiable hereditary disorders that can appear among the children of unknown carriers. These include congenital nephrosis, but many will experience a far more common disorder like heart disease. I have chosen healthy activities like healthy exercise and a mostly vegetarian diet, yet my genetic health risk factors will impact my health and life expectancy too. Sadly, millions of US-born adoptees in the United States will never know their family health history because most states deny them access to their birth records and thus knowledge of their identities. Unlike many adoptees, I found my biological family in the late 1980s, despite having my records sealed. My birth state, Michigan, still denies birth records to thousands of adoptees born there by law. To date, no medical health group or public health groups have publicly supported changing state adoption laws that deny birth records and family medical history to millions of US-born adoptees. This year, public health practitioners can join with adoptees in legislative advocacy to improve the health of millions by changing these laws. To learn more about legislative activity, a group called Adoptees United publishes a list of current legislation. Thanks for adding your voice as health and public health professionals who can make a difference in improving the health of a long overlooked group still unable to achieve the full potential of good health. Signed, Rudy Owens, MA, MPH, Portland, Oregon. For the record, I am not a member of Adoptees United. I did contact him to let them know I was using their name in this letter. I did not see any negative feedback from them, so I believe that is still okay to mention it in this context of this video. Thank you.